Hi, my name is WendyHui, and this is for my anatomy class. I did my signature assignment um, for pulmonary edema. So we go to the next slide. Pulmonary edema, it's defined as an abnormal accumulation of extravascular fluid in the lung parenchyma. And this will actually lead to diminished gas exchange at the alveolar level, so it will cause respiratory failure. And there's two main types of pulmonary edema. The first one is cardiogenic pulmonary edema, also called volume overload, and the second one is non-cardiogenic pulmonary edema. All right, so the cardiogenic pulmonary edema, it's when your lungs are incapable to remove sufficient blood away from the pulmonary circulation. It arises due to the hydrostatic pressure of the pulmonary capillaries, and it's typically seen in disorder including the left ventricular systolic and diastolic function. And congestive heart failure, it's the number one reason that causing this. And the non-cardiogenic pulmonary edema is caused by injury to the lungs. Um, it could also be going to places with high altitude, nearly drowning, and other health conditions such as diabetes, smoking. It is not as common as cardiogenic pulmonary edema. The genetic, environmental, behavior risk factors are as follow, such as hypertension, kidney disease, obesity, diabetes, severe asthma, pneumonia, lung infection, sepsis, smoke or toxic inhalation, drug use or overdose, alcohol abuse, exposure to high altitudes, drowning, and severe trauma or injury. And there is an AI algorithm was developed by these researchers from MIT. They use chest X-rays to detect how severe the edema in the lungs are, and from there they use the data to um, find the diagnosis. Pulmonary edema is very, very common in elderly people. About 1 in 15 age 75 to 84, and 1 in 7 people age 85 and above who have heart failure. The reason I'm describing heart failure is because majority of pulmonary edema arises from congestive heart failure. Um, and it is the number one reason in the US that why people go to the hospital. And about 978,000 were admitted in 1998 with pulmonary edema. And not just the US, the UK and Australia and many other Western countries are also experiencing this problem. In the US, there's more than 3 million people currently, and every year there's 400,000 people present with these symptoms present. And if you look at the demographics in the US, Hong Kong, Europe, Indonesia, South Korea, 2%, almost 2% of the people of the population is having this problem. Male, it's most of the time the males are predominant in this, a lot higher than female. Their mean age is a little bit older, like from late 50s to 76 years old. And you can see there's these factors, not just cardiovascular. There's also diabetes, also a majority of the reason people with this too. African Americans patients are about a time and a half more likely to die of CHF than white patients, and the incidence is much greater in males than females from age 40 to 75 years. Although in China, it's much rare in rural cities, but in the urban cities, there's 4.2 million people are actually suffering from this. The reason being behind it could be our diet, it could be the air pollution. There are many reasons, but they most of the time they all result in pulmonary edema. So this is a structure of our lungs, and above there's a trachea. You can see these branches, left, right lungs. These are the bronchioles. At the end of these, there's alveolus. So there's like a rich capillaries around it, and this is where gas exchange happen. There's three factors that determine how fluids moves in and out between the capillaries and the interstitial space. The hydrostatic pressure, oncotic pressure, and capillaries permeability. And you can see here there's a healthy alveoli. When there's edema, there's water in these alveoli. So the cardiogenic pulmonary edema, it's caused by the increase of hydrostatic pressure. It's normally due to the left ventricle failure. So increase the pressure to the left ventricle, which transmitted to the left atrium, then it goes to the pulmonary veins. And the pulmonary vein will respond by dilating, and the pressure continues to rise, then the fluid will start to leak from these vessels to the interstitial space between the alveoli and the surrounding. And as it continues to leak out, it will eventually flow into the alveolus. So normally our lungs, we have a very nice pulmonary capillary system. The pressure is really, really small. It's almost zero in the lungs. So, there's only a little bit fluid will go in and it will remove by our lymphatic system. But with the pressure keeps building up and from the edema situation, it will eventually reach out alveolus. And for non-cardiogenic, usually it's due to injuries to the lungs, so it will result in a negative pressure in our chest, so which results in a ruptured capillaries and it will flood the alveoli with blood. Here are the symptoms: shortness of breath, coughing up like red, frothy blood, excessive sweating, cold and pale skin. You can hear crackling sound when you listen to the heart, irregular heartbeat, fatigue, swelling in our legs and feet, wheezing, anxiety, rapid weight gain, and bluish lip. And the 5-year mortality is about 60% in men and 45% in women. This is retrieved from Framingham Heart Study. Diagnosis usually is required. It is actually recommended to seek medical care right away because this can be very life-threatening. Chest X-ray, chest CT, pulse oximetry, arterial blood gas test, EKG, ECG, ultrasound of the lung. First treatment is a lot of people need oxygen, like with oxygen mask and everything. And these are the medication depending on the condition of the person. And with high altitude pulmonary edema, go back to lower elevation, rest, don't move a lot, and take medication if you need to relieve the symptoms. The outlook of the prognosis, it really depends. Everyone's condition is different. Some might be chronic, some could be acute, some might need a breathing machine for a long time. And there are a few deep learning models out there that helps medical team these are the AI model to grade the different stages of edema so they can diagnose it correctly. So stage 0, so these was based on a large data set. So stage 0 would be no edema, stage 1 would be vascular congestion, stage 2 would be interstitial edema, and stage 3 would be alveoli edema. And here comes to the end of my presentation. Here are the references. From this, I concluded this is a very serious and life-threatening disease, but it may be reversed. It's a lot of times it's environmental because there's not much genetic information about it. I mean, we could totally have a better diet, live better, don't do any drugs. It can lower the incidence of this disease. And thank you so much again.